Let's move on to the last case. A 32-year-old man who resides in the slum areas presents to the OPD with complaints of severe diarrhea, vomiting since 3 days. So you see, acute condition. History of similar complaints are there in his family. He gives history of passage of rice water stool, very characteristic. On examination, pulse rate was found to be 90 beats per minute. Pulse was feeble. BP was 90 by 60 millimeter of mercury and patient appears dehydrated. So features of dehydration were present. So you see, when there is lot of volume loss, then pulse becomes feeble, volume of pulse is less and the blood pressure is decreased as seen here. Stool microscopy and examination revealed an actively mobile coma-shaped organism with single flagellum. So what is the most likely diagnosis in this case? The characteristic microorganism which is present here, that is actively mobile, comma-shaped with a single flagellum, it is definitely Vibrio cholera, and the presence of rice water stools also indicates presence of Vibrio cholera. And the Vibrio cholera toxin basically causes a secretory diarrhea. In this diarrhea, there is a loss of chloride, sodium and water. So what happens basically physiologically, small intestine secretes a lot of these ions, chloride, sodium, and along with that water also moves into the lumen of the small intestine. Now these secretions are absorbed by the large intestine. But this toxin, cholera toxin, basically increases the activity of the enzyme adenyl cyclase and thus increasing CAMP concentration in small intestinal cells, and this leads to prolonged opening of chloride channels. Hence, more and more chloride moves into the lumen. Along with that, water also moves by osmosis. Thus, the secretions are so much that large intestine absorption is overwhelmed and it is not able to absorb back the secretion. So, this leads to secretion of a lot of electrolytes into the lumen and loss of these electrolytes along with water. So, that is known as secretory diarrhea. Now, there is a reflex known as gastrocolic reflex, and in this reflex what happens, basically food accumulation in the stomach causes distension of stomach, and this leads to increased proximal and distal colon motility. Now, this increase in motility will cause the contents of the large intestine to move to rectum and there will be a sensation of defecation. So, this is basically mediated by gastrin secretion. The importance in this case is basically, you see, this gastrocolic reflex normally physiologically is present in children, but it is very much decreased in adults. However, in case of diarrhea, there is accentuation of this gastrocolic reflex, and whenever person takes food, they get a sense of defecation. Then finally, what will be the treatment of this condition? Obviously, there is loss of so much electrolytes and water, so that need to be replaced, isn't it? So there is a solution known as oral rehydration solution that needs to be given. And if there is excessive loss, right, so that will lead to extreme dehydration. So in that case, IV rehydration may also be required. Then antibiotics may also be given in case of severe dehydration. Then zinc supplementation is recommended because this zinc basically reduces the frequency of stools and decreases the probability of persistent diarrhea also. So zinc supplementation is recommended. Then along with that, immunization is also recommended for people traveling to areas with endemic presence of this Vibrio cholera. So this immunization effect may last for 6 months. So that is about Vibrio cholera. So with this, we have discussed 4 cases of gastrointestinal system, that is achalasia cardia, GERD, then steatorrhea and secretory diarrhea. Thank you.